So in terms of what's good in the UK for palliative care, I mean, first of all, we do have a specialty within medicine, and we've had a specialty within medicine of palliative medicine since 1987. So that's quite a long time. And we also have journals and we have academic development. So we actually work hard to develop new knowledge. We have a very good network of hospices, voluntary hospices in the UK, but increasingly palliative care and end-of-life care is being integrated into the health system. And at the Cicely Saunders Institute, that's a particular interest of ours, is to try and take something that initially went outside of the healthcare system so it could innovate back into the healthcare system in acute hospitals, in medical education, which is very important for all the doctors and nurses who are going to be coming along for the future, in postgraduate education of all different specialties. So I think we have those things to be helpful for, and it probably is also helpful that the National Health Service offers universal coverage. So people aren't falling through quite as many nets as they may be in other countries. And we don't have difficulties, and I think we've changed a lot of minds in the availability of drugs. I think another advantage that we have, in particular compared, say, to the United States, is that hospice and palliative care works much more closely together and really is one type of thing really in the UK. We have independent standalone buildings with beds that we call hospices or specialist palliative care units. We have some hospitals, not many, with a few wards like that. Most hospitals have palliative care teams, and most areas of the community have teams that will visit people at home. But patients don't have to choose one or another. They don't have to choose either palliative care or my acute care service. If I'm a person with a progressive illness and I'm in a palliative care service, if I suddenly have an acute illness, on top of my existing illness, I don't suddenly have to opt out of hospice and back into the system. I can have them both together at the same time. And when I'm in hospital, the hospital palliative care services will contact me and come and see me. So that enables us to do a much more flexible model where we work more in conjunction and in a shared way with the other doctors and nurses as an extra layer of support in a way, rather than as an alternative where you have to choose one or another.